Before we get started, I have a quick favor. I've been self-funding the Finding Genius podcast for 5 years now. I've done over 3,000 episodes. And as you can see on YouTube, we're up over 1 million views on the channel, which is fantastic. The next thing I really want to push on is to get up to 10,000 subscribers. Because once we do, we'll be able to put a donate button and we'll be able to solicit donations to help keep the podcast running and to also get the Finding Genius Foundation moving along. We have a big project studying anxiety, depression, and PTSD and working on a product to help people overcome these problems because I've seen them explode recently after the last 2 years of the whole virus situation. So if you would, please subscribe to the podcast. That would help us tremendously. Give us a thumbs up and check in the description for Buy Me a Coffee. It's about $5. If you could buy me a coffee, I'd really appreciate it. It would help keep the channel going, and I love coffee. Thank you.
Forget frequently asked questions,
common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
with Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius Podcast. My guest today is Mollie Kallen. She's an entrepreneur, a speaker, a cancer survivor, patient advocate, and the author of the upcoming book, It's Not About Me. So we're going to talk about how to cope when you're first diagnosed with cancer, which I know from personal experience and tends to cause your insides to liquefy or feel like they're liquefying and, your whole life is coming to an end. So it's a very, very big deal. But welcome, Mollie. Thanks for coming.
I well, appreciate for having me, and welcome everybody who's listening.
Yeah, if you would, tell me a bit about your background, what you're able to say, and I don't want you to have to repeat things that are too difficult to repeat, but tell me a bit about yourself and the audience.
Yeah, absolutely, no problem. I'm very comfortable talking about everything pretty much. So my background is, I'm originally from the Midwest. I'm from Cincinnati, Ohio, and I studied elementary school education. I was a teacher for quite a few years in suburbs of Chicago, and then I got my master's in counseling because I was kind of frustrated. So many things, the issues children were going through because both parents are working and so many things going on sociologically and everything. So I decided I wanted to be a counselor and work in the schools. But then once I got my master's in school counseling, I saw that most of the counselors were doing a lot of testing and really weren't doing a lot of the one-on-one kinds of counseling I wanted to do. So I then kind of got, into the field of workers' compensation through the back door, actually through an ad in the newspaper, which I always told people, you never find jobs through the paper. Back in the day when you used to get the Sunday paper and look for jobs, and I answered an ad, and it was for a case management position. So people don't know about case management. It's a great field. What it is when you have an injured worker who has a lot of complications or a lot of injuries or issues, you can bring a case manager either in person to go with them to the doctor's appointments and coordinate their medical care, or do it telephonically. So I was doing in person and I enjoyed it. And I was doing it for many, many years for other companies.
What would that look like, a case manager? I've never heard of such a thing.
Yeah. So a lot of people think we're pharmaceutical reps or attorneys. So basically, it's people who have a background in counseling, or they do now have degrees in case management, where and some of them are nurses to do it. I'm not a nurse, but you have to get certified. And you go to the doctor's appointments with the injured workers. You go in with them. You get their permission. You go in with them to the room. You're talking with them and the doctors. You're coming up with treatment plans. You're coordinating the care for them, like setting up physical therapy, MRIs, helping them get second opinions if they need to. And you pretty much stay on the case until they get to a point where they're medically stable and they return to work, hopefully full duty. And I also did vocational case management, where you help people who can't go back to their jobs, that have permanent restrictions, find alternative employment. So it was really, rewarding. I loved doing it. I did it for many, many years for other companies. And then I decided to do it on my own. And I started my own company, and it was just going to be me, Richard, nobody else. And it grew over about 12, 14 years from me to over 300 case managers across the country. And it was very organic. It certainly wasn't anything I had in my plan. It just kind of grew, and I really enjoyed it. And then I sold my company about 3 years ago to another company, the IMA Group. Wow, fabulous company.
One quick question here. When someone shows up to a doctor's appointment or anything medical and they have a case manager with them, what's the treatment look like? Not how are they treating them, but how are they treated by the physician differently?
So it's a good question. Usually as case managers, we have a relationship with the doctors, with the office managers, with the nurses there. So we're usually able to kind of get quicker appointments, get quicker answers, get things done faster, get people into MRIs, therapies, coordinate all that kind of stuff. So it does definitely expedite the process for the patient, which if they're a motivated patient, is a good thing. If they're not a motivated patient, then they don't like things being expedited through the system and getting, good care and getting it quickly. So it's slightly different. Sometimes you're dealing with people who want to go back to work. Other times you're dealing with people who no way want to go back to work, and they'll trump up their, diagnosis and their different kind of pain levels and things like that. So you see the whole spectrum for sure.
Okay. But are people, again, they're treated better? They're I've heard tons of stories of people being gassed by their medical providers, or shamed or yelled at or all kinds of stuff, really not helpful kinds of things. So I heard that with the case manager, they're treated better.
Yeah. I mean, a lot of what propels me now is the concept of advocacy. So as a case manager, you're an advocate for that injured worker. So most times you are getting a better result. You're getting the doctor to better focus and slow down and take time with that patient than if you weren't there. I found that to be true.
Are they won't say with the case manager there? How do you make sure the interaction still goes well? Maybe the doctor holds back or doesn't say things they would normally say if the case manager is there because they're worried about liability. What have you observed?
I have seen it go lots of different ways. Most times, like I said, we have a rapport with those doctors, so we've worked with them for a while. So they, understand us, we understand them. Sometimes as a case manager, you meet separately with the doctor, one-on-one. And sometimes the doctor is freer to discuss things of what's going on. I've noticed that if your doctor is a good doctor and is really secure with themselves as a person, as a doctor, when you recommend things or when you suggest possible second opinions or things, that doctor will say, oh yeah, it's a great idea. I would like to see what that other doctor has to say. Whereas if you have a doctor who's egocentric, who, feels very threatened, they're going to take the other approach and they're going to say, well, if you're going to get another opinion, then I don't want to treat you anymore. So I really feel that your better doctors really just don't have any issues or concerns with somebody else being there. It's the doctors that are either sometimes newer or the ones that have been burned before legally from attorneys and other kinds of issues that are a little bit more on the, defensive when it comes to case managers.
Okay.
So I started my company and I grew it to about 300 case managers. And then I sold it to another company, the IMA Group, fabulous company. And I've sold it now almost 3 years ago. And I'm still working for that company. I'm VP of Business Development, doing higher level kinds of things, working with clients, still working with case managers, supervising them on some levels, doing a lot of training, presentations and things. And then about 6 months after I sold my company, I got a cancer diagnosis of AML, acute myeloid leukemia. Came out of nowhere. All that it was found, I had no symptoms. It came strictly from blood work. So cautionary tale, make sure that you do your blood work and your physicals and do everything that you need to, because sometimes things will come up that you are not even aware of that you can get a jump on. So that was a real life-changing moment, obviously, for me. And I went through treatment, extensive chemotherapy, extensive hospital stay, and then I had a bone marrow transplant, and I did really well. But then about 4 months after that, I relapsed, and now I'm on maintenance chemotherapy, and I'm cancer-free. And it kind of propelled me to do what I'm doing now, which is my passion work, which is advocacy for those people who have cancer. And I'm writing a book about how to be your own advocate as you go through a cancer diagnosis. And it's not just for patients, it's for caregivers, friends, providers. And I'm also doing coaching and speaking about how to be a warrior and be your own advocate as you go through a cancer diagnosis.
So what kinds of things have you learned that would be helpful for other people, without spoiling the book, but, what can we tell people that have recently got a cancer diagnosis that are listening, or, in the near future, they get one, God forbid, and then they can think back to this podcast and be like, oh, well, that's right. She said to do this or that.
Yeah. And that's why I'm calling my book, it's like, it's not about me, because there's so many memoirs out there. And what I really wanted, and I envision my book as being, is like a guide, where it's tabbed and people can go to different sections. It also incorporates different voices. I was certainly going to put in my voice about certain things, but I have also voices of clinicians, doctors, nurses, psychiatrists, yoga people, yoga instructors, Reiki, survivors, single people, couples who've been diagnosed. So to answer your question, some good takeaways. So when you're first diagnosed, it's very hard to focus. It's very hard to put one step in front of the other. You're like in shock, and you go through all the different stages of grief. And it's so important to breathe and to realize that you're not alone. Start to think about who your village is, who you can count on. And certainly if you're married, you have your spouse. If you're not, you have a significant other. And if you're single, you've got friends or family members that come as your village. And I think it's really important to think as clearly as you can. Try to find a mentor. I do a lot of mentoring. There's a lot of resources on my website, and in my book, I have a whole section about resources. Finding a mentor is key. To talk to somebody who's kind of been through what you're going to be going through, or what you might be going through, is very, very helpful. It helps you relax a bit. It helps you kind of take some kind of control, because the biggest thing that happens when you're diagnosed is that you feel no control and you are just reeling. You're physically reeling, emotionally reeling. You might not be feeling great. And then all this stuff is coming your way, and it's very hard to digest it. So it's really important to have somebody like a caregiver, or somebody who's going to be with you through the ride, or several people who are going to be with you through the ride, to go with you to doctor appointments, to ask questions, to take notes, start a folder, try to stay as organized as you can. That's another important piece of advice. Get a Pentaflex and put different sections in there for your medical bills, for the notes from doctor's appointments, so that way you have everything with you. It's very hard to stay focused and to concentrate. And that's why it's really good also to always have a family member or a friend with you at a doctor's appointment. Another thing I think is important is you want to tend to isolate when you're going through it. You certainly don't want to retell your story 5 million times. That's why, I got my village and I had them do like update trees on texting. So I didn't have to retell my story or where I'm going 5 million times, because it's very stressful. Yeah, very stressful and depressing. And everybody has a different level of comfort of what they want to divulge. Some people go onto these caregiver pages, where you document yourself. I just wanted to have my friends kind of I had one person for my friends in one area, I had one person for my family in different kind of groups, and they were disseminating information and then sending it back to me, because you get to a point where you just don't want to be on the phone, or you don't want to retell things 5 million times, but you want to, receive the positive goodwill that people have, but you don't want to feel compelled to respond and retell the story over and over again. So that was really helpful as well, too. I put in things in my book about how to prepare for hospital stays, nuts and bolts kinds of things that are helpful to be when you're going to be in the hospital, because a lot of us have never been in the hospital for long periods of time. And depending on what your treatment is, whether it's inpatient or outpatient, you might be in for a while. I talk about how to deal with non-supportive providers, and how you can get second opinions, and how really to keep your voice and not lose your voice as you're going through this really, really rough time. It's really hard.
What do you mean non-supportive provider?
Doctors who are just not supportive, who are just negative Nancy's, who aren't giving you options. Just like I had mentioned with case management, doctors who aren't open to other opinion. You can have different types of doctors. They all have different personalities. Some people you want to have somebody who's a handholder. Sometimes you don't want to have somebody who's not. If you don't connect for whatever reason, and it's a very individual kind of thing, Richard, if you're not connecting with that doctor, and that doctor's going to be with you for a while, then you need to research other options, because you rely on that doctor to disseminate information to you in the way they talk to you. If a doctor's talking to you in a very condescending way, the doctor's really not listening to you. Those are all reasons to really rethink, think about.
What about people that, the doctor pressures them to do something and they may not want to, or the family's pressuring them? You need to do what the doctor says.
Yeah, it's hard because you'll get a lot of like 50 different advice, and you need to kind of make a decision that's best for you. And that's why, Richard, it's really key to have a good medical team, a team that's accessible to you, that listens to you, that isn't condescending to you, because they're going to be your litmus test. They're going to be the ones that you're going to go to when you have questions. Hey, I heard about this. What are your thoughts? You have to have that trust. You have to have that relationship. And in a way, Richard, they become your family. They become your medical family. And you need to feel comfortable. and feel that you're being listened to and that they're responsive to you in some way. And it's really important to have that comfort level. And obviously, you're seeing multiple doctors usually, depending on what your diagnosis is. But whoever's going to be the main gatekeeper doctor for your care, there's got to be that level of comfortableness and respect between you two.
Yeah. That makes sense. What else do you see that people have trouble with? I mean, it becomes all consuming from my experience. If you let it, you think about it day and night, constantly, you isolate, you don't want to talk to people, you ruminate. How do you help people with the mental side of it, not just the practitioner side?
Yeah, I think it's really important to get counseling if you can. If your company has an EAP program, if you can afford counseling, if your insurance covers it, or there's community-based resources, social work, so important to have an objective professional person talk to who can help you work through. I mean, it's great to talk to friends and family members. No doubt you need your village, but it's really good to have that objective person. And I know me personally that I go in and out of counseling when I need it. And certainly through the whole process, I really relied and depend on my counselor. And she helped me tremendously. She helped me look at, instead of looking 3 weeks down the road, looking day by day, looking at the little wins, instead of the bigger picture sometimes. Helpful with navigating things like yoga, using yoga, Reiki, massage therapy. The hospitals lots of times will offer free resources, music therapy, art therapy, chair yoga, all these things. But having a counselor, I think, is key. And not only for yourself. If you have a spouse or significant other, or certainly if you have children, it doesn't even really matter what age they are, I think it's really important to get them into counseling as well, too, if you can, because they're dealing with their own fears, with their own sadness, with their own grief. Sometimes they don't want to even talk about it to you and burden you with more things, but they're going through their whole process, just like you're going through yours. And having that objective person to talk it through really makes a big difference.
Yeah. I mean, what else does the person need to know to help them navigate? I mean, I would guess people are impatient. They think, I guess they would think like death will be imminent all the time when it may not be, and they just want to get it over with and they can't take it anymore. As someone goes along with cancer for, let's say, 6 months, a year, maybe now it's 2 years, does the battle change? What does it look like if they've been through a bunch of treatment and things don't look like they're working, or if they go into remission, then it comes back and, now they're like, now they're really devastated. Do you go that far in the book?
Yeah, I think, let's kind of break it down. So when it comes to work, right, it's scary. If you're a sole breadwinner or if you're the major breadwinner, talking to your company supervisor, your HR department, as soon as you can, once you're able to and have an idea. I mean, you have no clue sometimes what's going to happen, when you're going to feel well, when you're not going to feel well. But having that conversation is really important so they understand and you understand. So if there's certain paperwork that you need to fill out, you understand what your insurance covers, what it doesn't. It helps you plan from a financial standpoint. It helps you plan from an emotional standpoint. So having that conversation with your HR and also knowing what kind of resources your company has regarding employee assistance program or counseling, all those kinds of things is really key. So I think that's important. Certainly, as you mentioned, we all have a different road, right? So, you can go through remission and then you relapse and vice versa and back and forth. And some people have to go through a certain point where there is nothing left for them to do. They have reached the end of the road. That's why, again, you have to have a really close relationship with your medical team so they don't give you false hope. There's certainly different kinds of trials that are out there and, so many advancements with medication and treatment and targeted treatment and chemotherapy. I mean, even in a year, I have a mentor, and I mentee other people, as I mentioned, and his process was so different than mine. And we had the exact same issues. So, being hopeful because things are changing so rapidly and in a positive direction. It depends on the cancer you have, the staging, your health, any kind of pre-existing issues that you have. But certainly, when you get to that point, which hopefully most of you don't get to. I mean, we used to think that cancer was a death knell the moment that somebody gave a cancer diagnosis, but there's so many people, Richard, walking around with cancer and that are survivors and thrivers as well. But for those who reach the end of the road, it's talking to your caregivers, it's talking to your family, figuring out what works for you, your plan. Do you want to be home? Are you in hospital? Do you want to have any kind of medications to keep you comfortable? And discussing this with your medical team as well as your family is really important. And that's rough. There's no easy way to put around that. It's very rough. And and scary. The other thing I would mention to people when they're first diagnosed is don't be afraid to ask for help for sleep. It's very hard to sleep when you're first diagnosed. And even as you're going through treatment, because of that unknown, because of that fear, because of the sadness and the grief, when you start to go to lay down and go to bed, your head starts to race. And it's normal. So I encourage people, nobody wants to be on medications unnecessarily. And obviously you have to get everything approved by your medical team, but to ask for help for sleep, whether it's something that's prescribed or over the counter, because you really need rest. Rest is important. Exercise is also very important to the best that you can do it. When I was in the hospital, I was hardly ever in my bed. Even on days that I felt like horribly, I forced myself to get up and walk. Mind-body connection is huge, huge. And those of people who work with cancer patients tell you it's a big game changer. And it's hard, you can't always be the glass half full. You have days or weeks or months sometimes when you just feel horribly physically and then emotionally, and it's all connected. So making sure you get sleep, making sure you get good nutrition. Lots of times your hospitals will have nutritionists available for you to talk to. I think that's really important, especially when you're dealing with chemo. And, chemos are a lot better than they used to be, but, you're still going to have nausea. You might have other kinds of things like nausea and diarrhea. It's so important not to get dehydrated. And they have options to help you with IV fluids, but you have to be in charge of you, and you know your body better than anybody. So again, you don't want to wait until it's too late. You want to jump ahead, be proactive versus reactive before it kind of goes down a road. So listening to your body is really key. And you're going to hear lots of people telling you what to do, what to eat, what to talk to experts or talk to people who have been through it before, and stay focused as much as you can and listen to your medical team. Those are all really important.
Okay. I don't know. Do you see a lot of people that are going through cancer that are handling it badly that need this advice? Or is it more of a case like everyone needs this help, regardless of what they think actually, because cancer is so serious?
Yeah, that's a hard question. If you have somebody who is resistant to therapy, forcing them into therapy is probably not going to be a successful situation. They're going to go in with a preconceived notion. It's like almost like, polarizing themselves for failure. So I don't know if that's the right road, but if someone's open, whether it's with the patient, without the patient, with a child, without a child, I would suggest even just trying it for a couple of times. It makes a huge difference. So is it a game changer? I think so. My background's in counseling. I've seen a huge difference in myself and other people who have gone through counseling, just even whether you don't even have a cancer diagnosis. I've always said that people who go through counseling, it's like a mirror in front of you. It's very brave to go through counseling. It's important to have that objectivity, somebody who has no skin in the game, who's objective and trained to talk to you about how you're coping, what you can do to cope better, and that's really key. But it might not be for everybody, it depends on the person, but I recommend it, and sooner than later, when you're first diagnosed, it'll help you deal with it as a patient. It'll help your caregiver, and if you have kids or family members, to deal with it and how to deal with you, because that's an important thing. What do you say? What do you do? Even from a work perspective, how much you disclose, who do you disclose it to? How do you want to interact about it? How much do you want to talk about it? There's a lot of heavy issues to deal with. And then on top of it, you might not be feeling well and you're scared. And so it's multi-leveled. And that's the reason why I think counseling is so important, because it helps you feel a little bit better about how you're dealing with it. It gives you coping strategies. And for me specifically, Richard, it helped me, instead of looking at weeks and months down the road and being depressed, looking at chunks of days and looking at the little wins versus the bigger picture. Because sometimes you really focus on the small versus the large and breathe and just know that you're doing the best you can with the best that you got. Sometimes that's all.
True. What are these counselors called? Is it just a psychotherapist, or are there specific, like either hospice counselors or end-of-life counselors or cancer counselors? Is there something?
Yeah, most your counselors, whether it's psychologists or social workers, clinical psychologists, they all are trained to assist people that are going through these types of life kinds of crises and issues. So, there are counselors that, and psychologists that maybe specialize in oncology. If you can find them, that's great. Sometimes it's difficult to find those people, and depending on where you live geographically, and certainly now with telehealth, depending on what your insurance is or your employee assistance program or your community resources, most people you can see by telehealth, which is, it's fine. I see people from telehealth and there's no issues with that. But I think there's no real distinction per se. You can, feel free to interview your therapist before you start. Hey, I'm going through this. What is your experience with this from a professional standpoint? Have you seen a lot of patients that are going through this? I think that's important. Same thing with your medical providers, asking questions, before you decide to treat, if you have that luxury of time to do that, and find somebody that you're comfortable with. And again, with counseling, you might have a session with somebody who might be very qualified, but you just don't have a connection. And if that connection's not there, odds are it's not going to be a successful partnership. So you might want to try somebody else. So sometimes it's a trial kind of thing, but don't be afraid to speak your mind and go with your gut. I think that's really, really important in life in general. In your gut, if you're not feeling comfortable about something or someone, then address it.
Why not? Why aren't there people that cancer-specific psychotherapists? It seems like that would be a good designation to build up your particular training.
Yeah, when you go through, your education from a collegiate standpoint, you can take classes and stuff, but your degree, they don't have specific degrees in that area. But that's why when you're talking to or interviewing, counselors, ask them what their area of specialization is, what their area they, enjoy working with, who primarily their practices. Yeah, there's oncology massage. There's oncology, specialists who specialize in different types of oncology from a medical standpoint. But from health,
will be something with your background. This would be something you're uniquely positioned to create. Like a set of training for therapists so that they can address the problems. Like cancer specific.
Yeah, and I think being a patient myself, it gives you a whole different level of empathy and understanding.
I know you don't have enough to do, but
but not saying that that a good counselor is only someone who's experienced things, because a good counselor is someone who's a great active listener, who's empathic, is good with sending you to different resources. That's what really makes a good counselor. But yeah, I'm careful in what I do. It's coaching, it's not counseling, and there's a distinction between that. I'm not doing cancer counseling. I'm doing cancer coaching, more of a non-clinical and connecting people to resources if they need them. But it's more of a practical type of a coaching where I'm like someone's holding their hand as they go through the process, advocating for them and teaching them how to self-advocate. Okay.
Gotcha. Okay. So where can the book be found? It's not about me, or is it's still pending publication, or is it out there?
Yeah. So I'm almost done. I'm just writing the conclusion and editing. It should be done by the end of the year. If you go to my website, www.cancercoachconnection.com, there's a wait list for the book. And there's also how to get in touch with me. There's resources there. I do speaking, presentations. So all that stuff is there. And I'm all on all the different social media channels as well, too.
Is it going to be available in audio format too, or just read?
Yeah. Yes. We're going to be viewing on Amazon and all the big, platforms and stuff as well. Yeah. There'll be audio as well. And hopefully it does well. We translate it and it goes across the world. And because obviously this is a need that's just not in the United States. It's something that's universal. It's affecting everybody. And if you don't know somebody now who has cancer, God forbid, I hope not, but at some point in your life, it will touch you.
And when's the anticipated release date? Do you know yet? Or
end of the year. We're looking, end of 2025. Mm-hmm.
Gotcha. Okay.
Yeah.
Well, very good. Well, Mollie, thanks so much for what you do and for coming on the podcast. Like I said, I've had experience with it, and really people need the help big time, because it's it's a terrible thing when you get a diagnosis, and like I said, your world can fall apart if you don't get the right help. So it's very important.
Yeah, thank you, Richard. And it's my passion. I really feel that people are just not used to advocating for themselves. That was my background as a case manager. And I really want to help people walk through this really hard time as successfully as possible from all different levels. And again, not just for the people who are going through it, but for the people who are surrounding the patient, as well as caregivers and friends and providers, to help educate everybody and being empathic to those people that are going through those diagnoses, and to let them know too that there's a lot of hope and there's a lot of light out there, and there's a lot of advances that are going on, and cancer is not a death knell. A lot of us are walking around and doing really well, thanks to our wonderful, doctors and our medical teams and our villages of people that support us. Very important.
Excellent.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.